We're going to talk a little bit now about what happens immediately following the delivery of your baby. But before we get started, I'd like to introduce myself. My name is Elisa Williams. I am a registered nurse and a lactation consultant and also a childbirth educator. This is a very special time for you and baby. You're going to be holding baby skin to skin. There's a lot of incredible things that are happening, and there's also going to be a lot going on around you. So we want to talk about what some of those things are. So the first thing is an APGAR score. This is a scoring that the nurse quickly does by checking your baby's breathing, their heart rate, whether they're moving their arms and legs, whether they're crying, and looking at their skin color. So it's a scale from 0 to 10, and your baby's score may be called out, it may not. Go ahead and ask for it if that's something you're interested in. And any score of 7 or above means that your baby is doing great. The next thing that will happen is a brief physical exam. So this can happen while your baby is skin to skin with you. The nurses will be looking at your baby's symmetry, alignment, looking for any obvious skin issues, looking for any birth defects that might be obvious, as well as looking at your baby's breathing pattern, their movement, and just their general physical well-being. After we look at that, there's a series of newborn tests that we usually do. Some are done in the delivery room, and some may be delayed or deferred until after the first hour of life and after your baby's had an opportunity to breastfeed. Your baby may be given some ointment in their eyes. It's an antibiotic ointment that helps protect them against any bacteria that may be transmitted through the birth canal from mom to baby. Your baby may also be given a vitamin K shot. It will be given in the thigh. Vitamin K is important. Some babies may have issues with clotting, and there are procedures that we do where we do have to prick the baby's heel. We'll talk more about those. And so vitamin K can help to make sure that baby clots and heals appropriately. The next thing that we may offer is a hepatitis vaccine. So hepatitis is part of a 3 series of immunizations that is usually given as a shot in the other thigh. And it can be done immediately following delivery or at your baby's first appointment with their pediatrician. One of the next things we'll do is a heel prick and take a little sample of your baby's blood. This is often called the PKU test. This tests for some metabolic disorders that may or may not be genetic, and your pediatrician will discuss the results of that test with you at one of your first well baby visits. We also will do a hearing screen. So 1 in 1,000 babies may have a hearing disability, which can be identified early at birth. It's a simple test where we just detect whether the baby's hearing nerve, auditory nerve is functioning appropriately. We also will do an oxygen test on the baby where we test their oxygen saturation. This is a way we can check early detection of heart defects as well. Skin to skin also helps with pain control for you as well. So while these things are happening with baby, there's possibly a repair going on of the perineum. There may be an examination going on. So being focused on your baby, having those endorphins from the skin to skin is great for both you and for the baby.
When after birth will the pediatrician see the baby?
Well, that's a great question. So there's different situations. It depends on where you're delivering, if you're at a hospital or a birth center. Some hospitals have 24/7 pediatric coverage. So when the baby delivers, the nursery staff will contact them and they'll come right over. They may come into the delivery room and actually do their assessment there. So that's the first time that they will encounter the baby. And then usually you'll have a 1-week appointment in the office with them. So they will see them in the hospital. They usually will see them each day before you go home because there's a lot of things changing with your baby. So they'll update you on any test results, start giving you some discharge instructions as they come and visit you and baby in your room each day that you're at the hospital. So next we're going to talk about newborn appearance. Newborns are very unique. They have some unique qualities and characteristics. So always like new parents to kind of be prepared for those and aware of those. So we want to talk a little bit about jaundice. So jaundice is, it can manifest as a yellow discoloration of the baby's skin, usually becomes visible at about 2 days of life. It is caused by a substance called bilirubin, which is actually a byproduct of red blood cell breakdown. It's because the baby's liver is not mature enough to process that quickly through the baby's system, and so it goes into the bloodstream. We want baby to feed a lot and have lots of dirty diapers. That will help metabolize the jaundice. Some babies will require further evaluation, but many babies after day 7, it's not really a concern anymore. Fontanelles or soft spots are common in all babies. So your baby will have those kind of in the center of the head, one that's about 3 centimeters by 3 centimeters, and another one toward the back of the head. These spaces are thick membranes where the skull leaves room for the plates to overlap during birth. If you put your hand there gently, you may feel your baby's heartbeat there. Don't be alarmed, that's very normal. And you may feel ridges on your baby's head in the hours or days after birth as the skull kind of goes back to its normal shape. These will close on their own at about 2 years of life. The baby may also be covered with a white cottage cheesy substance. We call that vernix. It's a lubrication for the baby's skin. It also is a natural barrier from environmental bacteria and viruses as your baby is born out into the world. One thing many hospitals offer now is delayed bathing, because there's been a lot of research to show that leaving this vernix on the skin, maybe gently wiping it but allowing it to be absorbed, can be very protective against launching the immune system, which comes through the baby's skin. Milia is something you may see on your baby as well. You see it a lot over the bridge of the nose, sometimes on the forehead or cheeks. It may look like acne. It's actually not. There's nothing you need to do about it. Once baby's skin starts functioning, oil glands are producing oil to lubricate the skin, and the pores start to close. This milia just kind of goes away, and one day you may not notice it anymore. Just routine care and bathing with just a washcloth and warm water is sufficient. Mongolian spots are darkened areas of the skin. They may look like a bruise, but it's actually just a darker pigmentation. It's very common to see it at the lower part of the back and also sometimes on the butt cheeks. These do fade over time. It's unusual that they would stay, but again, if you have any questions about your baby's appearance, it's great to ask the nurses and talk to your pediatrician when they make their weekly visits or daily visits too. Along with Mongolian spots, you may also see some red areas or red marks at the nape of the neck, sometimes on the face. Those will be called port wine stains or stork bites. They're very common too, and many of these also fade. While they may look alarming, there's nothing actually dangerous about it, and again, most will go away by the time the baby is 2 years old. Another thing you may notice on your baby's forehead or on their cheeks, also on their lower back, is something called lanugo. So it's a fine, downy hair. Actually, again, serves as a protection inside that watery environment, helps the baby sense things on the inside, and eventually just kind of rubs off as you dress your baby, as you bathe them, as they writhe around on their sheets. You will get rid of most of that. If your baby is born before 37 weeks, you will notice more vernix and more lanugo, as both of those things tend to kind of disappear from the 37th week through the 40th week. So circumcision is usually performed after the first 24 hours of life and sometimes before you're discharged from the hospital. It's a short procedure. It takes less than 5 minutes to do. Once the procedure is done, baby will be brought back to your room. The nurses will teach you how to change the dressing on the circumcision each time the baby wets or has a poopy diaper, and you'll do that for about 3 days following the procedure. As you go home, you'll be given some special instructions on what to look for, things like signs of infection and also signs of healing, and what to report back to your doctor if you have any problems. We've talked a lot about what happens in the delivery room immediately following birth. We've talked about newborn procedures. We've talked about what your baby's going to look like and circumcision. And next up, we're going to talk about feeding your baby.